So Cassandra worked for us for 3-ish years, right? And you left, you got married. We miss you.
I miss you guys too. I do.
So what was it like going to other offices? You've been looking in, you live in Tulsa now.
Yes.
Yeah.
So I've been applying to other offices, and I've done a few working interviews as well.
What's that like?
It's not so great because working here for almost 3 years and seeing everything that you do is so different, so advanced with all the best technology, and then going back, I feel like I'm going back like 100 years, honestly, when I go to offices.
What's different?
Like the treatment's so different. It's
Are they diagnosing it?
They're diagnosing treatment, but
Properly?
the treatment that they're diagnosing is not proper. For example, I was at this one office where he said it was clearly a tooth, it just needed a crown.
Yeah.
But he said, no, let's get it extracted and then we can do a bridge.
Yeah.
But I was like taken aback by it because it wasn't a big issue. It was just like a crown issue. But the thing is, both adjacent teeth were completely healthy.
Yeah.
They're completely fine, but he wanted to mess with those teeth to make
So he
a
looked
bridge.
at 3 times the amount of revenue. He's working 3 teeth
Yes.
instead of the 1,
Yes.
which would have been more work.
Right.
Yeah, for less money.
Exactly. And I was just like so surprised. And then we did an extraction that day as well.
Wow.
And it was terrible because he just took it out. And that tooth had an abscess, had a cyst. He took it out, put his finger in there just to feel if there's any like root fragments left in there. He said, okay, we're good. And we said
And that's it. In contrast, around here, we're using the lasers to clean up the socket, the ozonated saline, the piezos,
everything.
getting the ligament cleaned out. Yeah.
Yeah. And it was just so, it was terrible just to see that because I was like, this patient, the patients trust the doctors.
Yeah.
And the doctor's not really.
It's all about trust.
Yes. Yeah.
And they don't know anything.
Yeah. And that's the thing. Like, they were super sweet and all, but just the treatment, how it's done, I know wasn't the best for the patient.
Yeah.
And I really miss, working here where it's like, we know we're doing the right thing. Like, it's so
honest.
obvious.
Yeah.
And it's honest work.
What do you miss the most about, like, what we do?
I like that it was very organized. It was very organized.
Yeah.
And I really miss working with you.
Well, honesty, right?
But honestly, that's the big thing.
Yeah.
Like, patients had questions and you would answer them. You were very upfront on what they needed and what they didn't need.
Yeah.
And just with all the stuff that we use for a treatment, it was knowing that we're doing it right.
Yeah.
We're making
well,
sure.
no one knows it all. We don't know it all, but we try our best.
But we
it's
tried our
literature
best.
based.
And we tried our best, and you're always, wanting to find the next best thing.
Oh, yeah.
Always, all the time.
So no PRF, no microscopes, no CAT
when I asked about
no T-scan.
when I asked about PRF, if they did, PRF, or when I talked about ozone, or when I talked about in-house labs, when I talked about microneedling, when I talked about root canals, they were just quite confused of what I was talking about. And when I talked about like TMJ stuff, they were just confused. They were looking at me kind of funny. They're like, "What are you talking about?"
Well, they don't have a clue.
Yes.
Yeah. Well, that's kind of our niche, though. Yeah, the bite.
Yeah.
But it should be everyone's niche.
I know.
It's messed up. Well, we miss you.
We miss you, Cassandra.